Now, remember I was talking about withdrawal. It gets to a point where people are taking the drug to avoid withdrawal. Well, what typically happens is that because if you're injecting, let's say heroin, it can be smoked, injected, or snorted. If you're injecting heroin and all of a sudden you start feeling that feeling of withdrawal, and you're looking for veins, a lot of times, I can find a vein pretty quickly. You take it enough, you're going to have trouble finding a vein. So as you're trying to look for a vein, you're starting to go withdrawal. And what typically people will do, they'll muscle it, or they call it subcutaneously, they'll just stick it into their muscle, which tends to increase your chances of infection, and you get abscesses, right? The other thing about the use of drugs is it also, because the body is trying to more or less deal with the drug use, your immune system is severely compromised. Aside from the fact you're not getting any sleep, and or you're not eating properly. So you're more likely to get infections, and you'll see people picking at their skin and scar tissue because of that. Okay, heroin is the most common drug to overdose on, simply because of the tolerance. You don't know what you're getting. Even a difference between a 30% and 35% pure can cause a hangover, overdose in somebody if you're not used to the drug. And you hear about it in the news that there's a spate of deaths in downtown Eastside because new drugs are coming in. People are used to a certain amount of drug, a certain amount of purity of their drug, and they don't get it. And that can cause overdose. Now there's what typically with overdose, if you catch somebody quick enough, it's called Narcan, which is an adrenaline, the opposite of a depressant. Stick it into your chest or inject it, and you'll just like pop up. And they'll ask you, do you want to go to the hospital? Some people will say no. Problem being is if you have too much heroin in your system, the Narcan wears off, the heroin stays there, you overdose again. That's heroin. That's the typical color, right? And there's different colors. And there's little wee balloons, little flap. These things are a work of art, like origami. Some kids in jail taught me how to make them. They're like this small, but they're like envelopes, little flaps. Like, I was always impressed. So the differences, this basically they may have added baking sugar or whatever, just to make it a little bit more white. One of the drugs that I'm noticing a lot more use of and a lot more dependence on is OxyContins. And so Percocet and OxyContin are used to relieve pain. Very, very good painkillers, and actually relatively new. They only came out on the market in 1996, but they're very, very effective. It contains oxycodone, which is similar to morphine coated in heroin. And it's in both Percocet and Oxycet. Now Percocet is a slower lasting, lasts about 5 hours. Okay? OxyContin lasts about 12 hours. Now the problem with the OxyContin lasting 12 hours is that obviously it's a time-release capsule. Well, what happens when you grind a time-release capsule? You're getting 12 hours worth of drugs all at once as opposed to, so increased chances of overdose when that occurs. And as in any kind of depressant, it's a respiratory depression, so you stop breathing, more or less. So as I was saying, the risk of death can occur when it's broken, chewed, or crushed. That's what it looks like. These on the street go for $1 a milligram. So even the smallest amount is going to cost you $10. Okay, up to 160 bucks. And people use 80 to 100, whatever. There's all different types of dosages. Hallucinogens, typically what we think about is acid, LSD, visual, auditory, or kinesthetic hallucinations. They can be very frightening. And out of all the drugs, these are very much context dependent. If you're in a stressful environment, if you're in an environment where you're not sure of, you're more likely to have a bad trip. Whereas if you're in a kind of a loving hippie set, you're okay. And I don't know if any of you ever watched the Woodstock concert footage. One of the guys goes on stage and says, please don't take the brown acid, because it was bad acid. Okay, so you can get bad batches. And once again, the long-term effects of this, you can have flashbacks and may cause psychosis, especially if you are prone to bipolar or schizophrenia. Okay, then ecstasy, the effects are similar to amphetamine and hallucinogens, but it's typically considered an hallucinogen. Okay, the biggest risk factor with ecstasy is your brain literally overheating. Okay, it actually overheats your brain. That's why they sell water at raves and in parties, and you have to keep on drinking, grinding teeth, but you keep on drinking water. And you never mix it with alcohol, because alcohol dehydrates you. Okay? Research on humans is actually limited in terms of the long-term effects, so we really don't know. But there is some evidence that that damages the cells and the chemistry of the brain, especially with learning and memory. Okay? I mean, in the past 20 years, we've kind of gone a long way in terms of what drugs do, just simply because of MRIs. We can see what the brain function is. And what is interesting too is that a lot of these drugs, they've shown kind of before and after that brain activity after 2 years actually starts to get back to normal if you abstain from the drug for 2 years, typically. That's an acid blocker. So each one of these, I don't know if you can see, is a little stamp, and it's infused with acid, LSD, and you just put it on your tongue and it dissolves. Now, what people will do is we'll hold this will go right into your skin and it'll cause you to get high too. And it comes with all these whimsical characters, everything from Bart Simpson to biblical quotes. And they've got a bunch of different names for it. Okay? That's ecstasy. That's an ecstasy tablet. And once again, it comes with different names. You know, there's a VW there. And the most common hallucinogenic, obviously, is pot. Okay? And that's what it looks like. This is not very good, by the way. It's too much of this stuff. As kids always tell me, that's crap stuff. It's usually the green part, not the stems you're smoking. Those are how you smoke the joints and the pipe. Just put it in there and you smoke it. All of this stuff is legal. You can get it in any tobacco shop because there's a sign that says you can use for tobacco only. Now, marijuana. There's a lot. I mean, there's a lot of issues with marijuana and legalizing, not legalizing. But the one thing I want to kind of talk about that is definitely contraindicated is for people that are susceptible to either schizophrenia or bipolar. Okay, it can bring the onset of these mental illnesses on if you use it too much. It doesn't cause it. You have to be susceptible to it, but it can definitely increase your chances of starting to suffer from it. Okay, so you have to be vulnerable to it. But we're not clear whether it's the marijuana causes the mental problems, exacerbates them, or is used to self-medicate. Because a lot of people, a lot of kids, let's say with ADHD, tend to use marijuana to try to calm down, try to help them focus. So, the other issue with marijuana is with cancer. There's no real strong link yet, but we don't know. But my rule of thumb is, if you're going to put stuff in your lungs, and part of the whole thing is to keep it in your lungs for a good 20 seconds or 30 seconds, probably not very good for your lungs. Okay? Just a general rule. I don't know scientific evidence of that. But so, towards the end here, dealing with addiction. How do you deal with it? And like I said, this is going to be kind of a shortened version. There's so many different ways, and not one size fits all. Typically, what you'll get from like family doctors, you're an addict, go to AA, go to NA. That doesn't fit with everybody. Okay? So, there's a model that we use in British Columbia. First of all, how's everybody doing? You okay here? You good? Okay, excellent. There's a model that's used in British Columbia for any kind of treatment centers or to kind of guide us. And it's the Prochaska Di Clementi Stages of Change model. This was originally developed for smoking cessation. Okay? Because they were wondering, is like, why is it that some people can quit smoking so quickly, others just can't quit? And what they found is that the treatments weren't fitting where the people were at. Okay? So, as all psychologists like, triangles and circles all comes together in one beautiful package here. Okay? So, typically you enter in the pre-contemplative. This is where you aren't sure you have an addiction. You actually probably say, no, I don't have an addiction. But people around you may see something's amiss. So you come in there and you're thinking, nah, you guys are exaggerating. Okay? But you come in here. So through a little bit more talking, and the next slide I'll kind of tell you what your kind of goals are as therapists, to kind of what you're looking for. Then there's contemplation. This is where you start thinking about it. Okay? This is where you kind of like, oh, yeah, you know what, I did fail that exam. Or, you know what, I didn't go to work because I was hungover like 4 times this month. The light bulb starts to slowly flicker. Okay? This is the, yeah, you're right, this is the yeah, but. Okay? And anybody says yeah, but, that just means no. Okay? Because if somebody agrees with you, then they say, but, well, they're not agreeing with you, okay? So this is the, yeah, but here's my excuse. So you got contemplation, you got them at a point where you're saying, yeah, you know what, I may have something, what are we going to do about it? Then you get into determination. Okay, Talino, I need to do something about this. This is screwing up my life, my wife wants to dump me, or whatever. Then you go into action, you decide what are you going to do about it? Once you do what you're going to do about it, you go into maintenance, and you maintain, and maintenance means you maintain that what you desire, what your action was. Now, action does not necessarily mean abstinence. Okay, that's the problem with abstinence. When you're dealing with 16-year-old kids, they cannot envision never drinking for the rest of their life, or they don't want to. And there's no point in me saying you can't drink for the rest of your life. That's not going to work. So you work where the person's at. You work at what they want to do. So the first thing I always ask new clients, adults and youth, do you want to quit? The first thing they'll say is, yeah. I go, no, do you want to quit? Not, does everybody else want you to quit? Do you want to quit? Well, no, I'd like to. Okay, how do you see this? How do you see your use? Well, I'd like to drink socially. Okay, let's work with that. But I always say that there are some people that cannot go from abuse to social use. That one drink will lead to 25 drinks. So we have to try to figure that out. Now, depending on where they're at, sometimes you can do a little bit of the harm reduction and say, okay, you know, like you want to cut 50%, okay, we'll cut 50%. Or you only want to drink at, Fridays. You know, I'll kind of actually get a whole, I'll get them to record their use throughout the month. And the first thing I do is actually ask, I kind of tally up how much they actually spent. That's always an eye-opening experience. It's like, how much do you pay for a joint? Oh, $5. Okay, how many joints did you have? It's like, holy smokes. And I go, you don't work. So where are you getting this cash? So there's that part, but it's also like, okay, you know what? Let's try working on this. You're smoking, let's say, 10 joints a week. When is the best day you think you can actually cut down? And we can kind of work. It's like, well, I work on Tuesdays and I'm really tired, but I'm going, okay, let's do this. You do it in short, incremental portions, which kind of shows them they can actually do it. Right? It shows them that they can actually have success. There's no point in saying somebody wants to go to 50% and just cutting 50% of their use, because they're either going to go through withdrawal, but B, they're going to fail. I mean, there's a reason why New Year's resolutions, like 85% of them, are broken by the end of January. Because people, I want to lose weight. What does that mean? So it's being specific. So the action is determined on the client. Okay? And then you maintain that. Now, part of the thing may be that eventually I want to quit, but not right now. That's cool. Or you know what, Talino, I'm going to turn 19. I want to celebrate when I turn 19. Okay, we'll stay clean for 5 months. At 19, this is what you can do. Okay? Best case scenario, you exit. Realistic scenario, you don't exit. Okay? You continue doing this kind of rinse and repeat thing. But you rarely ever go into pre-contemplative or contemplation. So there's a difference between a lapse and a relapse. A lapse is just a momentary, like if you're an alcoholic, you drink 1 day or 2 days, and that's it. And you're like, oh, what did I do? That's okay. A relapse is when I don't see you for about a month. Okay, there's the difference in terms of quality. Now, the important lesson that is you don't let a lapse turn into a relapse, because some people kind of take that. Well, I drank once, I might as well just go a whole hog. Well, no, that doesn't make sense. But that's to them. And a relapse is actually it can be a very important point, because it teaches you what happened. Where we typically make a relapse prevention plan where we kind of look at all the triggers, we look at all the things that might cause you to drink. Did we miss something? And if we didn't miss something, maybe you're not that interested in this. Let's move it around. And so you kind of cater it. So the first question I asked after that is, what did you learn? And what made you stop? What stopped this from becoming a relapse? You get a lot of information like that. And then sometimes there's cases where you just don't, things come out of the blue. I had a young lady come in, goes, Talino, I had the biggest urge to use meth again. She'd been clean like for 4 months. It's like, what happened? I was at Metrotown. I go, well, duh. She goes, no, I never used the meth. That wasn't one of my relapses. I was in the underground garage, and I just felt like using it. I go, did you score there? Did you use there? No, I can't figure it out. So basically it turns out that the exhaust smoke from the cars smells like crystal meth.